Please join me today in welcoming Drs. Manning, Sachs, and Lageman.
So first, what is depression? Depression, we tend to think of depression as sadness, and that is one of the cardinal features of depression, but you can have depression without knowing that in fact you're feeling sad. Depression also includes loss of interest, loss of pleasure, so the things that once you really enjoyed doing, you don't enjoy doing so much anymore. Feelings of worthlessness or guilt, feeling like you've done something wrong, having suicidal thoughts or even suicidal plans. There's another category of symptoms with depression that are more what we call the vegetative symptoms, and those are symptoms that aren't so mood related but are related to things like low energy, feeling fatigue, feeling tired all the time, just not feeling like you have the oomph to get up and do what you have always liked to do. Weight gain or weight loss can be associated with depression. Difficulty concentrating, difficulty making decisions, sleep difficulties, and sometimes the sleep difficulties we see involve not being able to sleep, so waking up in the middle of the night and not being able to go back to sleep, or waking up early in the morning and not being able to go back to sleep. Sometimes what we see is hypersomnia, that is sleeping all the time, not being able to have the energy to get up, but really just wanting to sleep. And we can see psychomotor changes such as agitation. The person with depression might feel really agitated and unsettled. Or more commonly what we see is psychomotor retardation, which is when people just move slowly. They just don't have the quick kind of get up and go that they did. So one of the things that you might have noticed is that there's overlap between the symptoms of Parkinson's disease and depression. And so one of the things that we as clinicians want to be certain to look at is what the person experiencing Parkinson's disease alone, or are they experiencing depression as well as Parkinson's disease? And what we know is that people with Parkinson's disease are more at risk for depression than people without Parkinson's disease. A lot of the symptoms for Parkinson's disease are similar to the symptoms that we see with depression and anxiety, that they overlap. And so we have to be certain and ascertain whether what we're seeing is a symptom of Parkinson's disease, a symptom of depression, or a symptom of both. So regardless of the severity of depression, depressive symptoms are associated with things like decreased functional ability. So someone who's depressed is going to have a decline or a decrease in their ability to do everyday things. Increased caregiver stress is associated with depression and reduced quality of life. One of the positive things about depression is that it is treatable. So if we find that someone with Parkinson's disease is depressed, we want to treat that. And there are several ways to treat it. One is with pharmacotherapy. There was just a big clinical trial that looked at the efficacy of 2 different antidepressants on depression in people with Parkinson's disease in particular, and it was found that these medications are helpful for people with Parkinson's disease who are depressed. There have been several studies that look at psychotherapy, the effect of psychotherapy on depression, and psychotherapy is very helpful, and what studies show consistently is that it's the combination of pharmacotherapy, that is medications for Parkinson's disease, in conjunction with psychotherapy or talk therapy, that is best for treating depression. So now apathy. Apathy is not depression, and it's important to differentiate between the two. Apathy and depression often co-occur, but apathy doesn't involve sad mood. What apathy is lack of motivation. So it's a hard time internally getting the initiative to do something. So someone with apathy might sit in the chair and not do anything. People might look at that person and assume that it's depression, but not necessarily, because the person with apathy isn't necessarily sad, they just lack the motivation to get up. There's a lack of interest. One of the things that I often discuss with patients who have a lot of apathy and with partners who are helping care for someone with apathy is that apathy is often harder on the partner than it is on the person with the apathy. Apathy doesn't involve depressed mood, it just involves a lack of internal motivation.
So I'll be talking about anxiety today, and I think a good way to start off the talk is by defining what anxiety is. Anxiety is the body's reaction to a perceived threat or danger. So an easy example to think of is you may go visit your neighbor, you open the door, her dog is there, he's growling and barking at you. You're going to feel some anxiety because there's a real threat, the dog might bite you. But of course, there's other situations in which there's less of a real threat or danger to your person, but you might still feel nervous. So you're going on a first date, you're going to the door to pick someone up, and you're worried if they'll like your dress or if what they'll think of you. So in both of those situations, you can have real anxiety. Anxiety has both cognitive and physiological components. So a cognitive feature of anxiety would be something like worry or having a thought run through your mind that you can't get out that's bothersome to you. And a physiological or physical feature might be something like sweaty hands or racing heart when you feel nervous. And we'll talk about these more in a minute. Some mild anxiety can be a completely normal reaction to stressors. So, for instance, maybe you're going on a date, or you're worried that you may lose your job, or you're worried about whether your child or grandchild is going to get into the college of their choice. Those are all perfectly normal situations in which you might feel a little bit of anxiety. Some anxiety in mild or moderate amounts can actually be helpful to you. It's anxiety that actually keeps you aware and alert. For instance, if you're walking down a dark alley at night, it keeps you aware of your surroundings and you're sort of scanning for potentially dangerous situations. But too little or too much anxiety, which is more often the case in what we see as psychologists, can be problematic and begin to interfere with your daily functioning. So for instance, when anxiety becomes overwhelming to the point that, let's say you're so fearful that something may happen to you in that dark alley at night, you may be taken advantage of, or someone may rob you, that anxiety keeps you at home. It keeps you from going out and doing the things that you might like to do. It keeps you from meeting family obligations, or it interferes with your ability to go and be productive at your job. It's starting to interfere with your day-to-day life. And that's when we start to worry that the anxiety has sort of crossed that line into being problematic for you in your life. So it's not an either or, that there is or is not anxiety present, but it's sort of how much and how that affects you that's important. So as clinical psychologists, we sometimes see people who have anxiety disorders, which I won't talk too much about today, but it's a series or a cluster of symptoms that occur together that interfere with your day-to-day functioning. And if you're experiencing anxiety that's becoming overwhelming or impacting your ability to do things day to day, it's important to talk with your doctor or a mental health professional so that they can ascertain whether or not what you're experiencing is normal, or if it's problematic, or if potentially the symptoms you're experiencing could be due to something like medications or side effects of medications. So I've listed some symptoms of anxiety here. The first one is, if you're anxious, you might have trouble relaxing. You might feel on edge or keyed up. You might notice that you feel more irritable than normal, or perhaps your spouse or family or friends may notice that you're more irritable. You could feel worried or nervous, again, that cognitive symptom of worry or of anxiety. You might have trouble concentrating or you might feel distracted when you're working on a task. You might have fears, or you may avoid situations. So in the example I gave earlier, you may be so afraid that something bad is going to happen to you that you don't leave the house very much. You stay inside. You avoid that situation altogether. And then, as you saw in depression as well, you can have some changes in your sleep. Maybe you have trouble falling asleep or staying asleep. You might have trouble waking up too early in the morning and not being able to get back to sleep. And then you can have physical symptoms like fatigue or headaches, muscle tension, perhaps in your shoulders or your neck. And then in certain types of anxiety, you can have symptoms like heart palpitations, hot flashes, or you can feel like you're trembling. So in much the same way that depression occurs more frequently or can occur more frequently in Parkinson's disease, we know that anxiety also occurs more frequently in Parkinson's disease than in individuals without Parkinson's disease. So there's not a one-to-one relationship. It's not that you have Parkinson's disease, so you will be anxious at some point, but there's a higher likelihood compared to people without Parkinson's disease. And there's a couple of theories as to why this might be. First, some of the same changes that happen in your brain and in the chemistry in your brain that affect your movements and your walking and your balance, some of those same chemicals are involved in your emotions and your emotional functioning. And so changes in those brain regions and in those chemicals can also affect how you feel day to day, whether you feel worried or you feel sad. Of course, as many of you may have experienced, there's also stresses that can be associated with having Parkinson's disease. Maybe you're not able to do the things as well in your life that you like. Maybe your golf game is not as good. Maybe your spouse has had to take over some activities because of changes that you've had. Those can all be stressful for you, and that can also result in some worry or some anxiety. So in other words, there's likely not a singular cause of anxiety in Parkinson's disease, but for some individuals it can be multiple factors that are playing a role. The best news about anxiety is that it's treatable. Similar to depression, there are a lot of treatment options and modalities that we know work very well, and there's a lot of strategies to help you deal with anxiety in your day-to-day life. So I think that's the positive side of anxiety, and my colleague, Dr. Lageman, is going to talk about those things now.
I think what's so important today for us to cover is that depression and anxiety and apathy can all be experiences that occur, and the big point is not to just live with them. They actually can make your disease worse, your symptoms worse, and they definitely make your quality of life worse. And I think the message, hopefully, that you're getting today is about all the things you can do to try to help yourself live as well as you can with Parkinson's. Specifically, I want to talk about a bunch of coping strategies that I hope you can consider and take home and then debate about what may be best for you. The first thing I want to talk about is your emotional wellness. One of the things that occurs when people are often diagnosed with Parkinson's, you have sort of that huge adjustment period, the initial shock and figuring out what that means and getting to the right doctors and tons of organizational things that you have to manage. You may find, either due to the symptoms of the disease or how you feel about the disease, that you get more and more isolated over time. This is something that we notice a lot of, and that is very important to work against, because our relationships with friends, our family, co-workers, any spiritual groups we're involved in, those relationships really help us cope with different things in our lives. And so as that kind of isolation can occur, I think it's important to pay attention to that, watch for that, and to work against it. Those relationships are critical, and they may change, particularly if you work less or are not able to engage in certain tasks. Part of the journey is to find out what you can do differently that can become new meaning in your life, so you're not just losing things. You may find at a certain point that talking to your friends and family, you're doing it every day, and you're feeling like you're overwhelming them. And there is a certain point where you realize, that's not quite enough help that I need. And I think when you feel that way, when that's not enough, the therapies we're talking about, individual psychotherapy is talk therapy. There's a lot of stigma in our society still today about mental health services. But talk therapy now is really something where you come to see a psychologist. They're very much focused on the problems you're living with now and coming up with strategies to make those better. 10 to 12 sessions can be very helpful. It's not where you're going to see them for the rest of your life or you're going to lie on a couch and pay thousands of dollars. So I try to always tell people about that. So the best way to find a therapist really is to ask people in terms of who they have benefited from. Often support groups can be a good source of finding a good psychologist or counselor that works well with people with Parkinson's or knows about some of those issues. Pastoral counseling can be another avenue if that's more comfortable to you. And I have support groups on there as well. These are not usually led by people who can provide clinical care, but that giant support network can be invaluable so that you don't spend all the time going to the wrong people to find the people you need. Often other people have had similar symptoms or issues, and learning from each other can be really invaluable. It also gives you a sense, just like I hope you have today, that you're not alone in this journey. You may have a unique experience with it, but you definitely can have some support with that. Other coping strategies for your emotional wellness, I put on here meditation and mindfulness, and I think someone else mentioned that earlier today. I put Yoda on here, so if you have the thought I do about meditation is that, you know, it's some sort of magical thing and people start sort of levitating off their cushions, and I can't even sit in that position, so I don't have much hope. What I want to tell you, though, is those techniques, they don't need to be the perfect meditation where you're meditating for an hour and doing it in this perfect form. These things are about taking time, kind of slowing down to notice your body, how it's reacting. It can be a lot about learning to look at your thoughts, the self-talk that you have. Sometimes we don't even hear it. Hear what you're saying to yourself and trying to come more into a place where you're accepting where you are rather than sort of always fighting yourself to do something differently. Some people benefit taking classes to learn this. Some people like to do it alone. But it's definitely something good to explore. And as well as humor. We did that laughter yoga in here, and I think that's another good example of trying to find joy in your life. You may not feel like there is a lot, but looking for that can be invaluable to helping your mood. Personal treats I put on here, often as things get more and more focused on managing the illness and coping with all the changes, you may not be doing things that really just are fun and pleasant for you. These can be very minimal things like having a cup of coffee with a friend that you don't get to see often. They don't need to be big involved things. Our pets are a giant source of support, as well as sometimes, as the doctors referred to, medication can be necessary because of the chemical changes that can occur. So it's not something where it's all or nothing. I talked about social connections, and I think it's very important to try to develop new connections and put some effort into meeting new people. Classes and volunteering can lead that to you, as well as developing new hobbies and interests. And we'll talk about that, because that's often a challenge I hear people mention to me is, I can't do something the way I used to do it. I can't golf as well or paint as well or whatever it is. And it's about coming to terms with that, but also looking for new things that you can enjoy. And that's very important. We also have many physical needs that we have, and these impact our mood. And so it's not that they are in a different box altogether. We definitely have our nutrition and sleep are key things that help not only our physical health, but help our mental health. I know you've heard some information today about diet and specific things that can help that. Sleep is very critical in that a lot of times we meet with people and they're never sleeping more than 3 or 4 hours at a time. That's not the really good restorative sleep. So that means your body isn't getting fully rested, but your mind isn't as well, and that can lead to mood and thinking problems. So that's very important to target. Physical strategies, certainly I talk a lot with people about activity pacing. And this is something very challenging in our society. We are usually focused on getting as much done and being as productive as humanly possible. Activity pacing is where you really pace yourself between activities and pick when you're doing things so that you're doing harder tasks when you feel freshest, but you're not continually working on them till you're exhausted. So a good example I often hear over and over from individuals is, I have good days and bad days, but when I have a good day, I just try to do everything. And how many bad days do I have then? It's usually like 2 or 3. That's not a good cycle to get in. And it's really a trap from our culture that we feel compelled to do that. I assure you, people generally are able to get more done if they can pace themselves. So in a good day that you get some things done, but you don't use all that energy up, you won't have as bad a day the next day, and you'll still be able to keep getting things done. But you have to kind of change your mindset. So that's something to consider. Meditation also has great physical impact in terms of our breathing. Doing deeper breathing can be very helpful to relax. Massage can be particularly helpful, particularly for some of the pain and fatigue. And Tai Chi I have on here as well. There's a lot of course classes and different things that can help people. I always like to talk a little bit about our leisure activities. So what we do with our free time. Exercise, you've heard over and over today as far as the importance of exercise and what is appropriate and helpful for you. I also think engaging in mentally stimulating things. This is about new learning, whether it's new classes, new information, puzzles, classes you do. And these can be things where you socially connect with new people that can be very helpful, as well as developing new hobbies. So I once worked with a woman who previously had been a great painter, and the tremor was just such that her control was never good enough to be doing what she did before. And it was wonderful that she could make that change to suddenly embrace. She says, well, now it's very abstract. She still enjoyed painting. Her assessment of what she was looking for, it didn't look like the product she had previously produced, but she still enjoyed it, and she gave herself that allowance to sort of have a different outcome now. It's all about enjoying what you do. So in terms of exploring new hobbies, sometimes we've been focused on something, we only do 1 or 2 things, and it's a little hard to reinvent ourselves, but I think it's worth exploring those opportunities. There's a lot of other relaxation strategies. I mentioned breathing. There's many different deep breathing kind of exercises that a psychologist in particular can teach you about. Guided imagery is another one, as well as music can certainly help our mood tremendously. And we often sort of lose sight of that. But a good example of that is I know when I'm cleaning the house, if I don't have music on, I feel one way. And if I have on really good music, it doesn't seem quite as a painful chore. So I think the key that I want to emphasize to you today is to kind of consider where you are with your emotional needs. We often don't pay attention to that. You may want to talk to your treating physicians or health professionals about how you think you're feeling. As the other doctors mentioned, there's sort of levels of this that are just normal life that's occurring, but it can get to a point where it's really impacting you and how well you're functioning. And when it crosses that line, working with a professional can really help you get that better under control. And that doesn't mean that you necessarily will need to keep working with that person for years. So I think it's important to ask for specialists. It is very helpful to try to find people who work either with Parkinson's or a general older population that understand how neurologic illness can be playing a factor in this. And certainly, I know a lot of resource centers, if you're in a more rural area and cannot find someone who specializes in that, I think a lot of centers would be willing to try to help give some information so you can get the care you need where you are. Certainly, insurance and cost of these things is always a big concern. So it's important to check in terms of your insurance to try to find in-network providers, and that often is your best coverage. And so we have a couple minutes left for questions, and certainly we're all willing to take any, but I wanted to kind of go over those so you can kind of consider what things may be helpful to you, and they may change over time.
Is anxiety the same as stress?
So it's a good question. I think that some of that may feel the same when you're experiencing it. I think when we consider things clinically, they're probably different things, but stresses in your life can result in you feeling anxious. So some of the examples I gave are, maybe you're at risk of losing your job and that makes you feel stressed. Stress can also be positive, but it can still cause anxiety. So maybe you're worried, will my grandson get into Harvard or Yale? Not a bad problem to have, but maybe it still creates some stress in you thinking, well, which one's better? Is he going to be farther from home in one or the other? So either a positive or a negative stress can make you feel anxious. So they're closely related, but I think they're a little bit different.
You mentioned that there were 2 antidepressants that had been found. And this is where I'm a little confused. Did you say that they were especially effective on Parkinson's patients, or that they were just as effective as other ones? Or
Okay,
I didn't understand
that's
what you were saying
question. There were only 2 that were included in this particular study or clinical trial, and they were Effexor and Paxil. And that isn't to say that others wouldn't be equally effective. It's just that in this particular clinical trial, those were the only 2 that were included. And so that we know that those 2 work better than placebo, but we don't know how others work. And it was a really important study because it was really the first large-scale clinical trial that looked at antidepressants in Parkinson's patients in particular who have depression, as opposed to just generally people with depression.
So the population was limited to people that had Parkinson's disease?
Depressed people who had Parkinson's disease.
Depressed
right.
people.
So that we know that those 2 are better than placebo, or better than a sugar pill, okay, in treating depression in people with Parkinson's disease.
We don't know if any others are equal.
We don't know. And there are other drugs that work through similar mechanisms, and so we could assume that they would be effective as well.
Hi. I understand that, when we're diagnosed with a life-changing disease, it's kind of normal, or any major life event, it's kind of normal to go through call it a grieving process, if you will, or a process, a period of processing and acceptance and all of those things. In a healthy cycle versus someone with depression and anxiety, how long would those go, and how would they vary? I mean, how do you track when you're newly diagnosed and you find this extremely emotionally overwhelming, whether you're within a normal subset or a more in need subset, shall we say?
So, a way that I would look at that is that if you are suffering, it makes sense to get help, and it is less important whether or not it's within the normal range or in terms of it's going to over time decrease, that it makes sense to get help at that point. And that sort of gets in a roundabout way to the question of, is the depression that people with Parkinson's disease experience related to just the fact that they've been told difficult information? Is there something about Parkinson's disease in particular that's associated with depression? And the research indicates that it's both, that people with Parkinson's disease are more susceptible to depression, and that depression crops up at different points of the disease in people with Parkinson's disease. So it tends not to be just that early on, once someone gets the diagnosis, that's when they're depressed. There have been studies that track over time when people with Parkinson's disease get depression, and it isn't always related to the onset of the diagnosis or when there are functional changes associated with the disease. So my answer to that would be, if you feel depressed, it makes sense to get help, to seek treatment.